Hey there, fellow cat lovers! Whether you're a seasoned cat parent or a new adopter, there's always something new to learn about our feline friends. Today, we're diving into an important topic that every cat owner should be aware of. We all know our feline friends can be masters of disguise when it comes to hiding illness. Cats are naturally inclined to conceal their vulnerabilities, a trait inherited from their wild ancestors. This makes it crucial for us, as their caregivers, to be extra vigilant. One minute they're purring on your lap, the next they're acting a little off. It can be subtle changes in behavior, like a sudden disinterest in their favorite toy or a decrease in appetite, that signals something might be wrong. Feline fever is one of those tricky conditions that can sneak up on you. It's not always immediately obvious, but it's a clear indicator that your cat's body is fighting something. Recognizing the signs early on can make all the difference in your cat's recovery. Early detection can lead to prompt treatment, which can prevent more serious health issues down the line. So, what exactly is feline fever? It's more than just a high temperature. It's a symptom that can be caused by a variety of underlying issues, from infections to chronic diseases. Simply put, it's a rise in your cat's body temperature above the normal range, which is between 100.5 degrees Fahrenheit and 102.5 degrees Fahrenheit, or 38.1 to 39.2 degrees Celsius. Monitoring your cat's temperature can be a bit tricky, but it's an essential skill for any cat parent. Just like in humans, fever in cats is a sign that their immune system is working hard to fight off some kind of infection or inflammation. It's their body's natural response to combat pathogens. Think of it as your cat's internal fire alarm going off. It's a signal that something's not quite right and needs attention. Ignoring these signs can lead to more severe health problems. While a low-grade fever might not be a cause for immediate panic, a high or persistent fever can be a sign of a more serious underlying issue. It's always better to err on the side of caution and consult your veterinarian if you're unsure. In the following sections, we'll delve deeper into the signs of feline fever, how to check your cat's temperature safely, common causes, and when it's crucial to seek veterinary care. We'll also provide tips on how to make your cat comfortable during their recovery. Remember, knowledge is power, and being informed is the best way to keep your feline companion happy, healthy, and purring contentedly by your side. Stay tuned as we explore more about feline health and well-being, ensuring you have all the tools you need to be the best cat parent you can be. Cats are masters at masking pain and illness, which is why it's crucial for us, as their devoted guardians, to be extra vigilant in observing their behavior. Unlike humans who might openly show signs of discomfort, cats tend to hide their pain, making it challenging to detect when something is wrong. This natural instinct to conceal weakness is a survival mechanism inherited from their wild ancestors. Therefore, it's up to us to be their advocates and recognize the subtle signs that indicate they might be unwell. When it comes to feline fever, there are some telltale signs that your furry friend might be running a temperature. A fever in cats is typically defined as a body temperature above 102.5 degrees Fahrenheit. While a slight increase in temperature might not be alarming, a significant rise can indicate an underlying health issue that needs immediate attention. It's essential to know these signs so you can act promptly and seek veterinary care if necessary. One of the most common signs is lethargy, or a decrease in activity. If your cat, who is usually a bundle of energy, suddenly becomes sluggish and spends most of the day lying down, it could be a sign of fever. Lethargy in cats can manifest as a lack of interest in their surroundings, reduced interaction with family members, and a general sense of fatigue. This change in behavior is often one of the first indicators that something might be amiss. Your normally playful and energetic cat might seem withdrawn, uninterested in their favorite toys, or sleep more than usual. Cats are creatures of habit, and any deviation from their regular routine can be a red flag. If your cat is ignoring their beloved toys or not engaging in their usual playtime activities, it's worth paying attention to. Increased sleep or rest periods, especially during times when they are typically active, can also be a sign that they are not feeling well. Loss of appetite is another red flag. Cats are known for being finicky eaters, but a sudden and noticeable decrease in their food intake should not be ignored. If your cat is usually enthusiastic about mealtime but starts to show disinterest in their food, it could be a sign of fever or another underlying health issue. Prolonged loss of appetite can lead to weight loss and other complications, so it's important to monitor their eating habits closely. If your cat suddenly turns their nose up at their food bowl, it could be a sign that they're not feeling well. This behavior might be accompanied by other symptoms such as nausea or gastrointestinal discomfort. It's essential to observe if your cat is drinking water, as dehydration can quickly become a concern if they are not eating or drinking properly. Providing fresh water and tempting them with their favorite treats might help, but if the issue persists, a visit to the vet is warranted. Keep an eye out for changes in their appearance too. A cat's coat is often a reflection of their overall health. A healthy cat will have a shiny, well-groomed coat, while a sick cat might show signs of neglect in their grooming habits. Pay attention to any changes in the texture or appearance of their fur, as well as any unusual shedding patterns. A feverish cat might have a dull or matted coat, watery or discharge-filled eyes, or a warm, dry nose, although a dry nose alone doesn't always indicate a fever. These physical changes can be subtle, so it's important to regularly check your cat's overall condition. Watery eyes or discharge can also be a sign of an upper respiratory infection, which is common in cats and can cause fever. A warm, dry nose might be a symptom, but it's not a definitive indicator of fever, so consider it in conjunction with other signs. Some cats might also exhibit behavioral changes, such as increased hiding, excessive grooming, or unusual vocalizations. Cats often retreat to quiet, secluded spots when they are not feeling well. So if your cat is suddenly spending more time under the bed or in a closet, it could be a sign of illness. Excessive grooming can be a response to discomfort or pain, and unusual vocalizations might indicate that they are trying to communicate their distress. Remember, every cat is different, and what's considered normal for one cat might not be for another. It's crucial to know your cat's typical behavior and personality so you can detect any deviations. Some cats are naturally more vocal or reclusive, so changes in their behavior should be assessed in the context of their usual patterns. Keeping a journal of your cat's habits and any changes you observe can be helpful when discussing their health with your veterinarian. The key is to pay close attention to your cat's baseline behavior and any subtle changes that might indicate they're feeling under the weather. Regular checkups with your veterinarian, maintaining a healthy diet, and providing a stress-free environment can all contribute to your cat's overall well-being. By being observant and proactive, you can ensure that your feline friend stays happy and healthy for years to come. If you suspect your cat might have a fever, it's important to act promptly. Cats, like humans, can suffer from fevers due to various reasons such as infections, inflammations, or other underlying health issues. Recognizing the signs early can make a significant difference in your cat's health and well-being. The best course of action is to contact your veterinarian. They are trained to diagnose and treat your pet's ailments accurately. A professional assessment ensures that your cat receives the appropriate care and treatment it needs. In the meantime, you can try to take your cat's temperature at home using a digital rectal thermometer. This can provide you with preliminary information that can be helpful when you speak to your vet. Before you begin, gather your supplies. Having everything ready beforehand will make the process smoother and less stressful for both you and your cat. You'll need a digital rectal thermometer specifically designed for pets, some petroleum jelly to lubricate the thermometer, and some treats for afterward. Treats can help calm your cat and make the experience more positive. It's also helpful to have a second person to assist you, especially if your cat is feeling stressed or agitated. An extra pair of hands can make the process safer and more efficient. Gently restrain your cat by wrapping them in a towel or blanket, exposing only their rear end. This helps keep your cat calm and prevents any sudden movements that could cause injury. Lubricate the tip of the thermometer with petroleum jelly and carefully insert it about ½ inch into the rectum. Make sure to be gentle and patient during this step. Be gentle and avoid any forceful movements. Your cat's comfort and safety are paramount. Hold the thermometer in place until it beeps, which usually takes about a minute. This can feel like a long time, but staying calm and steady will help your cat remain relaxed. Once you have a reading, note the temperature and clean the thermometer thoroughly with rubbing alcohol. Keeping your equipment clean is crucial to prevent any infections. Reward your feline friend with plenty of praise and treats for their cooperation. Positive reinforcement can make future attempts easier. Remember, taking a cat's temperature can be a bit tricky, so don't be discouraged if you're unsuccessful on the first try. Practice and patience are key. If you find it too challenging, don't hesitate to seek help from your veterinarian. They can provide guidance or perform the task for you. Your cat's health is worth the effort. Feline fever can be caused by a wide range of factors, from mild infections to more serious underlying conditions. One of the most common culprits is infection, which can be bacterial, viral, or fungal in nature. Upper respiratory infections, urinary tract infections, and abscesses are just a few examples of infections that can cause a fever in cats. Injuries, such as bite wounds, abscesses, or trauma, can also trigger an inflammatory response in the body, leading to a fever. Certain medications, vaccines, and even stress can sometimes cause a temporary rise in temperature. In some cases, feline fever can be a symptom of more serious underlying conditions, such as autoimmune diseases, cancer, or metabolic disorders. If your cat's fever persists for more than 24 hours, is accompanied by other concerning symptoms, or if you're unsure about the cause, it's crucial to seek veterinary attention immediately. Your veterinarian can perform a thorough physical exam, run diagnostic tests, and determine the underlying cause of the fever, allowing for prompt and appropriate treatment.